Well, my name's Andrew Anzeljc. I am the oculoplastic specialist at Baptist Eye Surgeons. I specialize in functional and cosmetic surgery of the eyelid, eye socket, and tear duct. The blepharoplasty is either a cosmetic or a functional procedure when done on the upper lids to remove excess skin and fat that either cosmetically bothersome or interfering with one's vision. It can also be done on the lower lids for purely cosmetic reasons to improve the appearance of the lower lids. Ptosis is most commonly caused by an age-related change that comes around with birthdays, but it can also be something that people are born with, and it can also be caused by multiple other things such as nerve damage or autoimmune conditions. So ptosis repair is a surgery aimed at lifting a droopy upper eyelid, and it can be performed in two different ways, from either an incision or a scar on the outside of the eyelid, or it can be performed by the undersurface of the eyelid where you see no visible scar. So when you're talking about upper lids, blepharoplasty and ptosis repair are pretty similar in most cases. Blepharoplasty is usually performed when there's extra skin hanging over, or an extra lid crease, or an extra fold that patients aren't happy with, either cosmetically or if it's interfering with their vision, and you basically are removing some combination of skin or fat. In ptosis repair, which can be done a couple of different ways, the typical procedure involves going down to one of the two main muscles that lifts the eyelid up and actually either shortening or tightening those muscles so that the lid starts at a higher point. So blepharoplasty and ptosis repair can both be performed for cosmetic reasons. So if they're bothering you, if the eyelids bother you the way they look, you can go ahead and do those surgeries. If your eyelids are drooping, either the skin of the upper lid's drooping over so much that it's interfering with your peripheral vision when you're performing daily activities, or the lid itself is drooping to that level, then you can have it done. Cosmetic eyelid surgery does not require a long procedure. Typically, both upper lids or both lower lids or all four lids are done within 1 to 2 hours if you do all four lids. And it does not require any lengthy hospital stay. Typically, it can be done in the office setting or an ambulatory outpatient surgery center or in the hospital setting, and you'll go home the same day. You can learn more about whether you're a candidate for cosmetic or functional eyelid surgery by scheduling an evaluation with me at Baptist Eye Surgeons.